In this segment, we're going to demonstrate a muscle energy technique, post-isometric relaxation method, for a hypertonic trapezius muscle. In this case, most likely a bilateral hypertonic state of the trap. There are a number of hand positions you can use for this. First one we'll show is just basically taking one hand palm up under the base of the skull in the suboccipital area. You can counterbalance that maybe with your hand here just to give yourself a little extra control, and then slowly bring the patient up into the flexion barrier. Once you find the flexion barrier, ask the patient to just gently push backwards towards the table with the back of the head, 1001, 1002, 1003, and relax. Feeling the patient relax and give, then you would slowly lift the patient up to the next barrier, asking the patient to repeat that, 1001, 1002, 1003, and relax. So 3 to 5 seconds. Feel that relaxation. If the patient gave again, you could go up, and you can keep taking this up 3 to 5 times through each restrictive barrier to the next. If you don't want to hold the head this way, you can simply just take both hands under the head and bring them up, have the patient push back that way, 3 to 5 seconds, and relax and repeat going through those feather edge barriers as they improve and improve. Or you can take the patient and bring the patient up either with one arm under, controlling the head this way, or actually taking both arms under the patient as you would do with a soft tissue technique where you were doing a bilateral fulcrum technique. But now just have the patient find that feather edge of the barrier and then have the patient push back into your forearm, utilizing both hands on the shoulders anteriorly, and relax 3 to 5 seconds. Find the new barrier, push back again towards my forearm, 1001, 1002, 1003, and relax, and just let it go, and then find the new barrier. And you can take this model here that we just did for a hypertonic trapezius, but you could take this for any large group of muscles, usually the long restrictors that might be affecting a specific range of motion, such as flexion or extension or side bending or rotation, and not use this as a intersegmental model, but as a more regional motion model. So, for example, I could take his head and say, let's try side bending, and if he just had a significant regional motion restriction in side bending to the right, I could take his head to the right barrier and then ask him to push his head to the left towards this thumb, just straight side bending. 1001, 1002, 1003, and relax, and then just take him to the next side bending barrier, etc. I could do this with rotation. So, for example, if you had a rotational barrier to the left, I would take him with this not really as a C1 on C2 or AA problem, but just as a rotational barrier for the region. Just say gently turn your head back to the right. And these are just post-isometric relaxation stretching techniques using muscle energy technique. And relax, etc. So these are using the long, usually strap-like muscles that work one area to another, sometimes crossing more than one joint, and affecting regional range of motion, not so much intersegmental.